I'm grateful to secure this debate. Approximately 130,000 adults in the UK have cerebral palsy, and although the NHS now officially categorises it as a lifelong condition, there is clear evidence that specialist support stops at 18. A national service specification for adult cerebral palsy in the NHS would ensure that the transition from childhood to adulthood is supported by relevant healthcare services and the necessary support. It would ensure that support continues to be provided throughout adulthood. I would like to pay tribute to UP, the Cerebral Palsy Movement, and Action Cerebral Palsy for their dedication in their advocacy for people with cerebral palsy throughout the UK, their campaigning on this issue, and support in preparing for today's debate. I wish to start the debate by talking about my own experience. As members will be aware, one of my daughters has cerebral palsy. Although she is still a child, I remain concerned about the level of support that will be provided to her when she reaches adulthood. This is a concern that I'm sure many parents of children with cerebral palsy will relate to. During your childhood, there are layers of support from your paediatrician to services often supplied at both school and through the NHS, including physiotherapy, speech and language support, and occupational therapy. Parents are rightly concerned about what the transition at 18 looks like and whether there remains wraparound healthcare. Sadly, the reality for many people with cerebral palsy is that this transition leaves them with little support to assist their health needs and help them function in life, including the support they need for day-to-day activities, including work. Throughout this debate, I will refer to the 2022 All-Party Parliamentary Group on Cerebral Palsy report called Barriers for Adults with Cerebral Palsy on Achieving Full Life Participation, Access to Healthcare Services and Progressing at Work. Though the APPG is now disbanded, the key recommendations remain relevant, and I pay tribute to my honourable friend, the member for the City of Durham, and the former member for Blackpool North and Cleveleys for their work on commissioning this report. For many adults with cerebral palsy, their experience is similar. They receive care and support through paediatric services before reaching adulthood and finding themselves in the position of what is essentially a cliff edge, without the support that they receive for the first 18 years of their life. Cerebral palsy affects around 1 in every 400 children in the UK, but the severity of each child's cerebral palsy greatly varies, and many have more complex issues, with 1 in 2 having a learning disability and 1 in 4 having a severe learning disability. The first recommendation in the APPG report outlines that NHS England, social care, education and employment specialists must agree a national service specification for adult cerebral palsy to be commissioned based on the needs of local populations within the 42 ICBs across England. Furthermore, in the 10-year health plan, the government has made the commitment that by 2027, 95% of people with complex needs should have an agreed personal care plan by 2027. Many adults with cerebral palsy do have complex needs, and with that, elevated health risks. They are 14 times more likely to die from respiratory disease and 3 times more likely to die from cardiovascular disease. In 2023, a review of 69 studies to assess the prevalence and incidence of chronic conditions among adults with cerebral palsy showed that adults with CP had the following conditions. 21% had depression, 21% had anxiety, 24% had asthma, 28% have epilepsy, and 32% have incontinence, with 38% having malnutrition. I would welcome the Minister's response outlining how the commitment in the 10-year health plan can be achieved for adults with cerebral palsy. I'd also welcome if the Minister could commit to considering how a national service specification for adult cerebral palsy can be implemented within the 42 ICBs, including encouraging ICBs to undertake implementing the NHS framework for the commissioning of services for children and young people with cerebral palsy to serve as a blueprint for adult cerebral palsy commissioning and provision. In March 2021, the then APPG on cerebral palsy published its first report entitled Early Identification, Intervention and Pathways of Care of Infants and Young Children with Cerebral Palsy, the Case for Reform and Investment. One of the key recommendations in that report was that all health authorities should be required to implement NICE guidelines. Dr. Charlie Fairhurst, Head of Children's Neurosciences at the Evelina London and chair of the National NICE Guidelines in Cerebral Palsy, accepted these recommendations, and they've been implemented into the NICE Guidelines for children. It's therefore disappointing that the recommendations for adults outlined in the 2022 report, including the full implementation of NICE Guidelines, have not been implemented for adult cerebral palsy in the NHS. Indeed, in May 2025, NHS England published a commissioning framework for children and young people with cerebral palsy. The framework aims to simplify and summarise existing guidance available, highlights best practice, pathways of care that could be replicated by other systems, and enables systems to identify population need through data. Over the past year, I understand 8 ICBs have been piloting that framework for children, which involves undertaking a baselining exercise to understand existing service provision and to identify service gaps for children with cerebral palsy. However, as we're aware, and as the 2022 APPG report highlighted, the needs of local populations differ across the country, and the results from just 8 ICBs are not enough to provide an accurate representation of the effectiveness of the framework. The postcode lottery of specialist support that we still see today constrains the lives of adults with cerebral palsy and results in worse health outcomes, not to mention the lower education and employment participation for individuals and the subsequent substantial economic loss. For example, analysis from the Northern Ireland Cerebral Palsy Register has shown the prevalence of cerebral palsy in adults is comparable to that of multiple sclerosis or Parkinson's disease. Absolutely, happy to give way.
Madam Chair, first of all, can I congratulate the Honourable Member for Bexley Heath and Crayford for bringing this forward, and also thank him very much for his personal story. That knowledge, personal knowledge, adds to the debate. Studies by Queen's University in Belfast indicate that adults with cerebral palsy often struggle to navigate adult health and rehabilitation services after moving on from paediatric services. This could mean limited access to physiotherapy, occupational therapy, speech and language therapy, orthopaedics and neurology. So does the Honourable Member agree that the best way to navigate this issue is to establish a clear, coordinated transition pathway from paediatric to adult services with dedicated case management so nobody is left behind in terms of their care? Thank you.
Thank you, Chair. And can I thank the Honourable Member for Strangford for the intervention. And absolutely, I agree. Those recommendations that were in the APPG recommendations from 2022, the example he's given from back in Northern Ireland, and that analysis has been done there. The evidence is there, and hopefully we'll hear from the Minister today about how we can continue to bring some of those matters forward. I would therefore welcome a commitment from ICBs across the country to implement the framework to serve as a blueprint for adult cerebral palsy commissioning and provision, as outlined by the Honourable Member. The second recommendation in the report highlighted the need to support GPs in identifying adults with cerebral palsy by extending the UK-wide quality and outcomes framework to incorporate the creation of general practice-level cerebral palsy registers along the lines of the expansion of QOF framework to learning disabilities. It would make a profound difference in the health outcomes of children with cerebral palsy transitioning into their adulthood care pathways. Therefore, would the Minister look to extend the Quality and Outcomes Framework to incorporate the creation of general practice-level cerebral palsy registers similar to the expansion of Quality and Outcomes Framework for learning disabilities? The third recommendation is to help ease the transition into adult care pathways through a national service specification for adult cerebral palsy in the NHS, which must include training covering adults with cerebral palsy for those working in general medicine, general practice and nursing from an entry level. For many adults with cerebral palsy, their primary coordinator of care is their GP, who, despite their best efforts, often do not have the specialist knowledge or training to support their patient. Written evidence in the APPG report highlighted that medical undergraduate students do not receive training about cerebral palsy in adults. One way to support GPs in identifying adults with cerebral palsy is to extend the UK-wide Quality and Outcomes Framework to incorporate the creation of general practice-level cerebral palsy registers along the lines of the expansion of Quality and Outcomes Framework to learning disabilities. It would make a profound difference in the health outcomes of children with cerebral palsy transitioning into their adulthood care pathways. Could the Minister outline how the current NHS staffing guidelines can be amended to include the incorporation of training for those in general medicine, general practice and nursing from an entry level to cover adults with cerebral palsy? The fourth recommendation in the APPG report outlined that each ICB is required to undertake a gap analysis of existing cerebral palsy services for adults against NICE guidelines and use the result to inform and guide their local commission decisions. This must include investment in services to support and address associated conditions. It should then be used to establish regional multidisciplinary cerebral palsy clinics for adults, providing access to a range of psychological, physical and complementary therapies. The recommendation highlights that by appointing disability access coordinators in acute and primary centres, they will be able to provide referrals to the clinics and ensure reasonable adjustments are made. The report also highlighted that an essential component in adult cerebral palsy care is the provision of a neurologist during the transition from childhood to adulthood to ensure there is no longer that cliff edge in the support received when a patient is discharged from their paediatrician. Could the Minister therefore agree to investigate how ICBs can undertake a gap analysis of existing cerebral palsy services for adults against current NICE guidance, and how ICBs can include adults with cerebral palsy in their integrated needs assessments? Furthermore, recommendation 5 of the report suggests that to ensure specialist services are provided, the Department for Health and Social Care should provide ring-fence funding to ICBs to enable them to develop the much-needed specialist services at a local level. So will the Minister therefore agree to look at ring-fencing funding for the 42 ICBs so they can develop specialist cerebral palsy services? Finally, I would like to demonstrate why national service specification is so greatly needed. Emma Livingstone, co-founder and CEO of UP, the cerebral palsy movement, is here today, and her lived experience perfectly encapsulates why a national service specification for adult cerebral palsy is needed. Emma was diagnosed at 2 years old with cerebral palsy. At 16, she was discharged from medical services after being told that she was the best that she would ever be. Unfortunately, without any integrated care during Emma's adulthood, she experienced a significant decline in mobility in her late 30s. This led to Emma having multiple surgeries and unfortunately having to give up her work as a speech and language therapist. In Emma's own words, "In my late 30s, my mobility declined rapidly. I needed hip surgery, then more surgeries, and eventually had to give up work. What shocked me wasn't the physical deterioration, it was the silence. The coordinated care I'd received as a child simply vanished when I turned 18. Emma is sadly not alone in experiencing this. The APPG report found that the transition into adolescence and adulthood is often accompanied by a decline in physical function, with up to 50% of people with cerebral palsy experiencing deterioration in walking function between 20 and 40 years of age. This statistic alone is reason enough to show why a national service specification for adult cerebral palsy in the NHS is so greatly needed." So in conclusion, Madam Chair, I would welcome the Minister's response to those 5 recommendations from the former APPG's report that I've highlighted today. Thank you.
The question is that this House has considered the national service specifications for adult cerebral palsy in the NHS. Minister Kiddo.
Thank you very much, Ms Jardine, and it's a real pleasure to serve under your chairship. And I'd like to really begin by thanking my honourable friend, the member for Bexley-Heath and Crayford, for securing this vitally important debate. Many members in this House speak on issues of importance to their constituents. Far fewer bring that depth of personal experience that he brings, that understanding and the long-term perspective that he has on this issue. So his own experiences of caring for a child with cerebral palsy reflect the realities faced every day by parents and carers across the country, and he speaks with such compassion and authority. Adults with cerebral palsy make up a significant but often overlooked part of our population, around 130,000 people across the UK. Yet for far too long they have been, in the words of the National Cerebral Palsy Charter, invisible to the NHS. Although cerebral palsy is a lifelong neurological condition, we frequently see well-structured multidisciplinary paediatric care systems that, upon reaching the age of 18, simply evaporate. Adults are left navigating a fragmented system, with no clear pathways, limited specialist input, and inconsistent recognition of their needs. We know that adults with cerebral palsy face disproportionately high risks of chronic pain, fatigue, mobility loss, falls, respiratory illness, and cardiovascular disease, harms that are preventable with coordinated, proactive care. Young adults who have both cerebral palsy and a learning disability often receive better support because they can access well-established learning disability pathways, which provide structured reviews, specialist teams and coordinated care. By contrast, young adults with cerebral palsy alone often fall outside these pathways and therefore struggle to access the same level of timely, proactive support, despite having significant and lifelong needs. On the point that my honourable friend makes on ring-fenced funding, we expect ICBs to commission services for people with cerebral palsy based on local population need, informed by NICE guidance and national service specifications. This approach is consistent with the wider NHS financial framework, which does not create condition-specific funding pots, but rather supports local systems to make evidence-based decisions across all long-term conditions. Similarly, on extending the Qualities and Outcomes Framework, or QOF, to incorporate the creation of general practice-level cerebral palsy registers. We're operating within a very challenging fiscal environment, and QOF indicators must be evidence-based, deliverable at national scale, and balanced against the need to reduce administrative pressures on general practice. Current policy is that ICBs should use NICE guidance and national service specifications to commission appropriate local services, rather than creating condition-specific national incentives. While we have no plans at present to commission any formal gap analysis of adherence to or non-compliance with NICE guidelines, I do wish to remind all ICBs of their responsibilities and the importance of adhering to those NICE guidelines. NHS England's revised specialised neurology services for adults service specification, published in August of last year, and which comes into effect next month, represents an important step forward in improving care for adults with cerebral palsy. For the first time, it sets clear expectations for how people with lifelong neurological conditions, including those with cerebral palsy, should move between general practice, community services and specialist centres. The specification requires integrated care boards and specialist centres to organise services using a population health approach, ensuring equitable access to both general and specialist neurology services and oversight from multidisciplinary teams. This means better communication between GPs and specialist services, clearer and more consistent referral pathways, and stronger recognition that cerebral palsy is a lifelong condition that requires timely review and escalation when needs change. On cerebral palsy specifically, the service specification mandates a networked, multidisciplinary model for adult cerebral palsy care, emphasising integrated care pathways, structured transition from 13 to 14, and annual reviews for complex needs. It ensures equitable access to specialists, specialised treatments like botulinum toxin, and requires services to address physical and communicative barriers to care. These changes will directly support early intervention, reduce unwarranted variation between local systems, and help embed more proactive, joined-up primary and specialist care, improving outcomes, continuity and quality of life for adults with cerebral palsy. The updated neurology service specification ensures that cerebral palsy is embedded within a broader national framework, strengthening national expectations for adult cerebral palsy care. One of the most important ways we are strengthening support for adults with cerebral palsy is by improving awareness and understanding within primary care. The service specification now requires integrated care boards and specialist centres to work much more closely with GPs, strengthening communication and clarifying referral pathways, so primary care clinicians understand when an adult with cerebral palsy requires specialist review or escalation. This is crucial because too many adults report difficulty securing informed support in general practice or face long delays in being referred to clinicians with expertise in neurodisability. These new expectations are designed to ensure that GPs have both the confidence and the clarity they need to identify emerging concerns, initiate timely investigations, and support adults whose needs may change as they age. Importantly, The specification also strengthens national recognition of cerebral palsy as a lifelong condition, helping embed more consistent, informed support for adults across primary care settings. This includes the requirement for services to identify barriers to access and make reasonable adjustments for disabled people, an important safeguard for adults with cerebral palsy, many of whom experience pain, fatigue, visual perceptual challenges, or communication needs that can affect their interaction with health services. These reforms mean that GPs are now supported by a clearer national framework, better referral pathways, and stronger system expectations. As we've already heard from my honourable friend today, too many adults with cerebral palsy feel that their support drops away as they transition out of paediatric services. That is exactly why the reforms we're delivering through our 10-year health plan are so critical to strengthening the support available for people with cerebral palsy throughout their lives. Our 10-year health plan sets out a vision for a health and care system that is more personalised, more integrated, and more proactive for people with long-term and complex conditions, including cerebral palsy. This means moving away from reactive care based on crisis points towards lifelong support that anticipates needs, prevents deterioration, and joins up specialist community and primary care services. The plan focuses on delivering more care in the community, making greater use of technology, and building a more preventative health service that supports people to stay well for longer. Our 10-year health plan will ensure that people with complex needs are supported to be active participants in their own care. As part of this, 95% of people with complex needs or long-term conditions will have an agreed personalised care plan by 2027. Care plans will be a feature of the developing neighbourhood health service, which will deliver more care in local communities and move away from a one-size-fits-all approach, giving people more power and choice over the care that they receive. Work is currently underway to determine the definition of complex needs in the context of this target, how care plans will be delivered in the future, including who will be best placed to coordinate and support the delivery of care plans. We know that key shared decision-making is central to patients' ongoing care, and care plans will look to promote this further. In developing future models of care planning, we will continue to take into account the varied experiences and needs of people with different conditions, such as cerebral palsy. We also recognise the importance of preventative, proactive care, including annual reviews recommended in NICE guidance for adults with cerebral palsy. While not currently mandated through the Quality and Outcomes Framework, these reviews remain an important mechanism for identifying changes in mobility, pain, fatigue and mental health, and for ensuring people are offered appropriate interventions early. The 10-year health plan's focus on personalised and proactive care will support integrated care boards to improve access to these reviews as part of a more consistent offer for adults with cerebral palsy. The plan will also ensure that no young person will be lost in the gaps between children's and adult services, a point at which many families tell us they feel most vulnerable. NHS England's Children and Young People's Transformation Programme provides a clear 0 to 25 model of care to achieve this. For young people with cerebral palsy, this means earlier preparation for transition, coordinated support from a multidisciplinary network, and clearer expectations for how professionals should plan and hand over care. Ms. Jardine, no young adult with cerebral palsy should reach their 18th birthday and face a cliff edge. They have waited far too long for the NHS to acknowledge their existence in policy, planning and commissioning. They deserve the dignity of services that reflect the reality of their lifelong condition. They deserve the best, and we are delivering improvements through integrated system-wide reforms designed to support lifelong person-centred care. The steps underway provide a more effective and sustainable foundation for improving outcomes for adults with cerebral palsy. So I again thank and congratulate my honourable friend for his tireless advocacy and work to ensure this issue receives the attention that it deserves. And I congratulate him once again on securing this very important debate. Thank you very much.
The question is that this House has considered the National Health Service specification for adult cerebral palsy in the NHS. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. Order. The sitting is now suspended until 2:30 p.m.